You're listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, this is Dr. Marzell, and today I'd like to talk about one of my favorite supplements, and that is B12, vitamin B12. Now, this is one of the most important supplements and vitamins that you can have. And why would that be? Well, it's involved in DNA synthesis. It's involved in red blood cell production. It's involved in breaking down homocysteine, which can cause clogged up arteries. And it's involved in a heck of a lot of things, and not only in the routine functioning of the body, but it can also be used therapeutically with some absolutely wondrous results. Now, why would I suspect anyone would be low in B12 after all? If we're not a vegetarian, we are eating animal products, and this can be dairy products and anything from an animal. You would think that we would have a goodly amount of B12 and not have to worry about it at all. But vegetarians aren't the only ones who should worry about a B12 deficiency. And the reason for that is it is extremely difficult to absorb, particularly if you have the following problems. Let's say that you have excess stomach acid or have been diagnosed as this. If you have reflux, if you have any ulcers, anything where you are taking medications, possibly self-prescribed versus from your local family practice doctor, if you're taking anything that inhibits the production of your stomach acid, you will have difficulty absorbing vitamin B12. Why? Because the stomach acid is important for the production of something called intrinsic factor. Now, intrinsic factor is kind of like a lead dancer at the ball. It grabs the B12 and escorts it through the intestines to a place where it's absorbed. And guess where that is? Way at the end of the intestines. So if you do not hook up that intrinsic factor with the B12 in your stomach, it will not be able to be absorbed even at the end of your intestines where it should be. So if we inhibit our stomach acid, and this actually pertains to other nutrients as well as B12, but B12 is particularly susceptible because it has to be hooked up with an escort service to bring it across the intestinal lining in the very last part of the small intestine. Now, so if you have anything, and let's just say that you're aging. Nobody is, of course, but studies have found that people who are greater than 50 years of age, there may be lack of stomach acid up to 50% at age 50. Actually, those statistics were pretty easy to remember, as you might guess. But as you get older and older, it's hard for the stomach to make enough acid. So if it can't make enough acid, even if you're not taking an acid suppressor, you may still not have enough B12 absorbed. Now, how can you tell if you have enough B12 or not? One of the big telltale signs is the size of your red blood cells. So when you have a blood count done, red blood cells are, there's a lot of information about your red blood cells. But the most important in regards to B12 is how big are your red blood cells. Now, if they're more than 95, that's getting pretty big. So what happens in your body when it makes red blood cells in your bone marrow? And it needs B12. It also needs folic acid, and it needs iron and other things to make red blood cells. But if we just look at it from a B12 perspective, if it doesn't have an adequate amount of B12, it holds on to those cells, waiting for an adequate amount to release them into the circulation. So what you're getting is normal looking cells, but they're just bigger. And the count will eventually be fewer. And this is what anemia is all about, not enough blood cells to carry oxygen. And the red blood cells are what carries oxygen. So if you take a supplement, it has to go to the stomach. There has to be enough acid to produce intrinsic factor. It has to hook up with the B12, and then it has to be absorbed at the end of your small intestines. Now, what happens on its journey to the end of the small intestines? There can be some extra bacteria there. And you know what? They really like that B12, and they will eat it up. And sometimes there won't be very much that makes it to the places where we can absorb it and receive benefits. This is why if you have a tendency to have large red blood cells or slightly anemic or severely anemic, and it isn't a bleeding problem or things like that, obviously. But let's say that you are anemic with large cells. It is really likely you're probably having a hard time absorbing B12. And this is why an oral supplement is sometimes not very effective. I can't tell you how many times I'll say a patient can present with some medical problem, which I'll talk about on my next podcast. But I'll say, well, maybe you're not getting enough B12. Oh, yeah, I take a supplement. Well, that may or may not work. It may work and worth trying, but this is why the administration of choice for people who are really deficient in B12 is an injection. Stay tuned for part 2 when I'll talk about some of the incredible things that B12 can be used for to treat all kinds of nasty things that can plague you. Stay tuned, and thanks for listening.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.